Zoom. Wonderful. Hello, lovely cam member zone. It's very nice to see you. Such a good turnout today. I have the gorgeous, gorgeous Katherine Clarke, Dr. Katherine Clarke. She works at Davies Veterinary Specialist. She was a massive hit at the Chronic Pain Symposium, did a wonderful presentation with the legend, that is Sarah Heath, talking about behavioral presentations, visceral pain management. And because she was so blinking awesome and so humble and so approachable, I've asked her to come back and talk to you guys. And I'm sure tonight we're going to bounce between topics. There's probably going to be dogs that have OA and comorbid visceral related discomfort. There's going to be cases where people are like, I don't know if it's the visceral pain or if it's OA pain. We're probably going to have dogs that they've been diagnosed with spinal pain, but actually they've got GI related signs. There's going to be a hodgepodge of stuff to talk about. But what I thought I would do is let Katherine take the floor first. And I've just said to her, please tell us things that you say day in, day out. They're not soapbox, but things that you just wish the public knew to get the ball rolling. Is that okay with you, Katherine?
Yeah, totally fine. Yeah.
Okay, so before you start speaking, you've got to tell them about how amazing you are and your journey to being an awesome, kind, humble specialist.
Okay, so I graduated from University of Bristol in 2011. It seems like a very, very long time ago now. And I worked in first opinion practice for about 7 years before thinking I wanted to do more, and then did a rotating internship, and then did my residency training actually at Davies. So that's like an extra 4 years of studying basically and selling your soul to the devil to become very specialized in a very small area really of veterinary medicine in general. So I now do internal medicine, so kind of gastrointestinal disease, renal disease, endocrine diseases, liver disease, respiratory disease, all those kind of things come in via internal medicine. Basically anything that doesn't have cancer, isn't lame and isn't neurological ends up pretty much on my consulting list. And then I have to try and work out what's going on with it. And so yes, that is my journey really to becoming a specialist. And I have been a specialist now for 3 years and very much enjoy it. And a massive percentage of my caseload is dogs with gastrointestinal disease, so chronic gastrointestinal disease or acute. And this has kind of very, very much led me down the pathway of learning about how the gut links to the rest of the body, really. And initially, I started looking at how the gut influences behavior. And there's a whole load of research at the moment into the gut brain axis in people and how important the gut is. And actually, if your gut is unhappy, that's very likely to have a negative impact on your emotional health. And we definitely see that in dogs. And so that it just made me very, very interested. And then, of course, once you start tapping into that microbiome environment and that literature, you realize how interesting it is. And then you uncover things like the link between the gut and osteoarthritic health and chronic pain. And it is unbelievably important. And back in the day, even, very, very beginning of time, Hippocrates said that all pathology begins in the gut. And I think that he was potentially not wrong. I do think the gut is incredibly important. And I suppose the take home messages really, I suppose I want to get across is that chronic low grade diarrhea, things like that. It's amazing how many owners will come in and, I say, how's the gut? Yeah, fine. How many times a day does he go to the toilet? Six. 6 times in a day? How many poo bags do you use? And because it's been chronically normal for that patient, they just don't perceive that it's a problem. Or, oh yeah, they have diarrhea, probably once a month, but it settles down and it's just because he's scavenged something. Well, we need to ask ourselves, why is that dog displaying that scavenging behavior? And it's very likely because that dog has a cold GI disease, possibly chronic visceral pain, that's driving that dog to perform those scavenging behaviors, which causing recurrent gastrointestinal upset. So I think for me, that's my number one take home message is that listen to your dog's gut. If your dog has once a month vomiting, that is probably clinically relevant. If your dog has intermittent chronic gastrointestinal tract signs, then don't ignore them, because if we can optimize that gut health, we will help the dog overall, emotionally, osteoarthritically, pain, everything will be improved by optimizing gut health.
Amazing. So you can have a few more kind of little soapbox moments. Is there a few more before we take questions?
I suppose my main treatment take home would be that, of course, diet and the gut are essential. The gut is a reflection of what you feed it. And therefore, when we're talking about managing chronic gut disease, it's not actually about pills and medications. In the vast majority of cases, it's actually about changing the diet. And there are two different, broadly speaking, different kind of diet trials that we can go down. So we can go down something called the hydrolyzed protein route. So essentially, what happens with chronic inflammatory gut disease is that the gut is full of immune cells. So, of all the parts of your body where you could potentially become sick due to exposure to the outside world, we expose our gut to the outside world every single day because we eat. So, there are more immune cells in your gut than anywhere else in your body. And when you have chronic inflammatory gastrointestinal disease, those immune cells start to become overreactive and start to respond to inappropriate things like the good bacteria in the gut or the proteins in the diet. So, when we do an exclusion diet, we want to feed either a new protein that those immune cells have never ever seen before, or we want to feed a protein which has been broken down into smaller fragments that the immune system doesn't recognize that it once was a chicken protein or a beef protein or whatever. So those broken down diets are called hydrolyzed diets. So those are the two kind of broad, we either go down the hydrolyzed diet route or the brand new novel protein diet route. And actually, this is something that in the vast majority of cases is safe to do. There are always going to be some situations where a particular diet is contraindicated, say due to pre-existing diseases, renal disease, liver disease, etc. But the vast majority of gut diets are pretty friendly to the rest of the body. So it is largely normally safe to start most dogs, including very, very young dogs, on an exclusion diet as long as you choose the right one. So that would be my second kind of take home message is that the diet, it's all about diet. And, we're now very lucky because there's lots of exclusion diets on the market. When I first graduated, it was a nightmare, whereas now we have insect, wild boar, venison, the list of novel proteins grows every day. There's even new quail, kangaroo.
Do
So
you know what?
the world is
There
your
wasn't
oyster.
any. When I
No, there
qualified,
wasn't.
no, you had
It was
to.
sensitivity control duck in tapioca, and that was it.
Oh yeah, there was capelin and tapioca. Do you remember that one?
Yes, yes.
But when I qualified, it was about asking the caregiver to create a homemade diet, and then that brought in a world of complexity. So
Yeah.
yes, we have put ourselves in a better position to do that. Um, and just explain to people, and then we'll kind of package that because we'll take questions from the field. But when you're talking about these exclusion diets and these diet trials and the influence of food on the gut, it's a commitment of 8 weeks, 12 weeks. What are you
So
suggesting to people?
it depends a little bit on the severity of the clinical signs. And normally, I would say that I would hope to see things going in the right direction within 2 weeks.
Hmm.
If there has been absolutely no improvement whatsoever, then I tend not to persevere. But that doesn't mean that the dog doesn't have a dietary responsive disease. It may just be that we've selected the wrong protein or the diet doesn't suit the dog or cat, to be honest. Same principles apply. So I will say we've done 3 diet trials using, and I'm happy that they are being done properly, i.e., they're not having a bit of cheese on top or a bit of shredded chicken on top or the
Or a
extra
dentist
bits
stick.
because or dentist sticks or any other bits. Then after 3 different diets, I then go, okay, well, this is either not completely dietary responsive or we need to do something else. And then further investigations or treatment may be employed. So even though they don't get on with one diet doesn't necessarily mean they don't have a dietary responsive disease. And the reason why I really push the diet is because all the alternative treatments come with side effects. So if
Mhm.
you have a dietary responsive disease, you are absolutely on to a winner. So I want to make sure that I have really, really, really ticked the diet box before I reach for anything else, because everything else comes with a con that the diets just don't.
Like it. Do you want me to read questions as they come in?
Yeah, sounds good.
Let me do this. Doodle-doo. Given that the gut flourishes on variety, is feeding the dog the same food every day something that depletes the variety of gut bugs?
So this is the answer to this is we don't know. And the data that the gut needs are kind of there's more and more data coming out in the human field that we need to actually be eating like 25 different things of fruit and veg a day, for example, to make our microbiome as diverse as possible. And rather than five, so it's not necessarily 25 portions, but actually variety is what would appear to optimize the human gut microflora, although that is still very much in process and understanding. We do not have that level of understanding of the canine microbiome at the moment. But one thing I would say is that be very careful about reading microbiome related stuff in people and applying it directly across to canines because we are a different species to them and therefore their requirements and everything are totally different. So the information that we have, and certainly my clinical experience, is that every time you switch the protein source, and it seems to be the protein, i.e., the meat in the diet more than anything else, you are more likely to upset the gut than help it. So, my chronic GI cases that are settled on an exclusion diet, a very good way to make them unsettled is to feed them a piece of chicken or they scavenge the other dog's food and suddenly they're exposed to a different protein source. So, in time, this advice may change. We are learning about the microbiome all the time. You know, it's a very, very rapidly progressing area of research in both human and veterinary medicine. But the variety diet stuff is very much coming from human medicine, and therefore I don't think we can apply it to my kind of canine population group.
And when they have those pieces of advice about 25 pieces of different,
Yeah,
food
yeah,
substances, that's for a healthy gut, surely.
yes,
It's so
yes,
it's a bit like on a similar analogy, when people talk about exercise requirements, they've been worked out
yeah,
in healthy dogs, not dogs with elbow dysplasia or hip dysplasia.
yeah,
So when you're looking for advice for diseased, it's going to be different, isn't it?
yeah, absolutely. And I think, the advice for, at the moment, fiber is very much bang on trend for people. And yet there was a paper published recently that actually fiber maxing could be bad for the GI tract and predispose to bowel cancer. That's a very, very recent paper published in Human Medicine. So it's we don't know enough. We do not know enough in human or in veterinary medicine to be making hard and fast rules at this stage in the game. We can only work with the information that we have in front of us. And at the moment, the information very much is single protein, consistent, novel. And that clinically works very, very well. And if you have clinically normal feces, no weight loss, good absorption of the diet, that to me is a sign that that gut is in a healthier place and therefore doing a better job.
Hmm. And that's really tough though, when people are very emotionally connected to their dog's food and they're wishing their dog to have variety because it feels good to them, the bond, you know, the
Yeah,
care. And so
yeah,
it can be very conflicting for the care. I'm terrible with my dogs. I'm absolutely terrible. Pate, ham, you
yeah.
name it. I'm
So
the
you'll be surprised to know
weakest
that
person.
my own dog has chronic enteropathy, and because he's obviously my dog, he has chronic GI disease, and but so he's never ever had any of these things because he's just always been a nightmare. But now he's actually on a hydrolyzed diet, and he's actually very very good. Um, but if you have a dog who's always, for example, I look after my friend's spaniel, and he always, whenever I have a roast, he has like the leftovers, and he cries throughout the entire Sunday evening because he knows it's coming. So then being able to say, I'm sorry, but here's some bobbles for supper, I think that's quite hard for everybody, including the dog. But these cases often, once they're stable, can have fruit and veg. So for some dogs, that is, they can have the odd carrot or a bit of apple or some blueberries or something like that, which is just something other than their diet, which normally appeases both dog and owner alike. There are some dogs that will tell you that, well, am I a rabbit? I'm not eating a piece of carrot, but the
Yeah.
vast majority of them are mollified by that.
And I think that's not to labor it. I think that's probably what I find quite hard when I'm managing these cases is that I get it. Me and Luna sit in the front of the van and I'm sharing my vegan sausage roll with her because that's what we do. And you're
Yeah,
trying to kind of like change that bond. There is a real destruction of that bond that you have to get over, isn't it? It's really
yeah,
challenging.
yeah.
Um, so moving on, we're going to take questions, guys. So if you have got questions, get them in. Otherwise, I'm going to keep linking back to OA because that's what I do.
I
First
love it.
question is from Laura. Is there anything you should do to support gut health after using antibiotics?
Love that question. That's a good question. And I'm afraid I'm also going to say I don't know. So, should we give probiotics, for example, after a course of antibiotics? There are a couple of studies. So, the first thing to say is that our ability to assess the health of the microbiome is quite poor. So, if you do, for example, like cultures of poo, then you don't really get representative information because some bugs that live in the gut just will not grow in the lab. Absolutely not. So, you only get the ones that grow, and therefore they sometimes outgrow the other bugs. You also, there are some bugs that don't come out in the poo at all, especially the ones that are further up the gastrointestinal tract. So we use something called the dysbiosis index to assess how well the microbiome is. And basically, what the dysbiosis index is it's a PCR. So what we are doing is we are looking for the DNA of certain species of bacteria to see whether or not they are there within the microbiome, and if they are there, what abundance they are there in. And the problem with the dysbiosis index is that we are asking the machine to tell us what bugs are there. So it's only going to represent certain populations, but research over the time has picked out certain species of bacteria that have specific roles that we know are very important. So there are studies looking at the dysbiosis index before antibiotics, immediately after antibiotics, and then after probiotics. And unsurprisingly, the dysbiosis index gets worse after antibiotics because we've got depletion of that population of bacteria. And what we can see with some probiotics is that there is an improvement in the dysbiosis index, but there is one study that shows, sadly, a further deterioration in the dysbiosis index after the addition of probiotics. The other thing is when we're talking about probiotics, we use this word probiotics as in plural. A lot of the veterinary probiotic stuff that you can buy just contain one single bacteria, something called Enterococcus faecium, rather than a kind of a mixed population of bacteria. So if I really want to give probiotics, I tend to actually reach for the kind of the human multi-strain high dose products, which are not licensed in veterinary patients, but they're not medical, they're just probiotics, as in they're not medicinal. But again, they are based on our microbiome, not their microbiome. So our information about how we allow or how we support the microbiome following the administration of antibiotics is really quite inadequate. I can tell you what I do as a clinician. I don't routinely recommend probiotics after antibiotics unless I have a specific concern about gut health. So, say, for example, if I have a very, very young puppy with parvovirus or something like that, I'm giving that puppy antibiotics because it needs it to treat its primary disease. And that dog has a developing gut microbiome. So in that setting, I'm desperate for that dog to have the best microbiome it can because it's such a baby in its life. So in that setting, I might consider reaching for probiotics. But it's very complex and it's not a completely straightforward answer. I would say though that giving probiotics is we have no evidence that it's harmful. So
Mhm.
the worst that we're going to do is waste our money, but there is no evidence that it will do any harm.
Amazing. So I'm just going to tag on to that because I know that we have a big tendency to provide pro and prebiotics after acute diarrhea cases. It's a here, go home
That's the
with your
thing.
Promax. Here, go home with your
Yeah,
Procolin. Here, and it's
yeah.
is there any evidence to suggest that actually that's going to change the course of that acute diarrhea episode?
So I think honestly, I would give procolin for acute diarrhea. I give it because of the kaolin, not because of the Enterococcus faecium. The kaolin is like a clay substance, and there is actually a study looking at protexin, and it did shorten the duration of acute diarrhea sign. But I truly think that that is the clay absorbent in it, not the probiotics. Again, it doesn't do any harm. Maybe the prebiotics do more than the probiotics. So prebiotics are things within the diet that feed the microbiome. So things like fiber. And the more you feed the microbiome, the healthier it is. And there are some species within the microbiome that, so for example, soluble fiber is a great example. If you give a gut soluble fiber, there are some species of bacteria within the microbiome that eat that soluble fiber, thank you very much, and feel much better for it. And then they produce something called short chain fatty acids. And short chain fatty acids are the food for the cells that live in the gut. So the more short chain fatty acids, the healthier the enterocytes are, which are the cells that line the gut, the better your gut mucosal barrier is, so the better your gut health is. So I think there is more and more evidence for fiber in the management of chronic enteropathy in dogs, for example. So maybe actually giving things like Promax is good from a prebiotic point of view, if not from a probiotic point of view.
Amazing. Okay, next question. If the gut is upset and this affects emotions, could this cause repetitive behavior? Maggie poos at least 4 times a day, and if I'm not there, will turn around and eat it. She will also eat other dogs' poo. If I'm not quick, she occasionally has afternoon diarrhea. Vet suggested Weetabix.
Okay, interesting. So, first thing to say is coprophagia, which is the medical term for eating poo, is totally disgusting, but not actually concerning. And it's not fully understood why some dogs display coprophagia. My own dog, if it can get hold of rabbit poo on a walk, it's like his birthday all over again. It's absolutely ridiculous the amount of rabbit poo he can eat. Sometimes I'm like, honestly, I do feed him. Um, so there is a school of thought that some dogs will eat their own feces because they feel like they need microbiome support. This is a theory. This is not evidence-based. This is just some people's interpretation. I think some dogs will also do it because of anxiety, because, for example, they've gone in the house, they feel anxious about that, and that will drive them to display that behavior. Many puppies will do it for multiple different reasons, including just being a puppy. Again, some people believe that it's to try and help their developing microbiome, but I think with very little evidence of that, I think. I can't remember the rest of the question, Hannah. What was the second bit?
She will see, yeah, I'm not, she occasionally has, is it linked to repetitive behavior? If
Okay,
the gut is upset and affects emotions, blah, blah, blah.
so yes, I mean, certainly we can see some, I mean, significant behavioral changes. And some of my, so say you have a dog that's already a little bit reactive, but, barking on people past the house or something like that. Any kind of pain state, whether that be gut pain, orthopedic pain, any kind of pain state this is Sarah's area more than mine, but when you know yourself, when you are in pain, your threshold for tolerance is lower. You feel more on edge, you feel more reactive, and your dogs are exactly the same to that. And I know certainly my own dog, he can be a little bit reactive, and if his guts are playing up, then this is a surefire way to lower his threshold, and he is more likely to be more barky and more reactive. We can see repetitive behaviours in dogs with gastrointestinal disease. Classically, there is something called fly biting, where they kind of jump up into the air and look like they're trying to catch a fly. And we think that this is associated, certainly in some dogs, with gastroesophageal reflux disease. So this is where they have constant kind of reflux of material from their stomach up into their esophagus, plus or minus up into their mouth, which essentially causes heartburn pain. And we can see fly biting behavior, but also kind of lots of gulping, swallowing, exaggerated kind of lip licking. Sometimes they'll be absolutely fast asleep and they'll jump up like they've been stung by something. And that's because stuff has just come up into their esophagus and they suddenly feel that and feel very uncomfortable and they'll jump up from sleep. But it can cause all kind of behavioural changes, including lack of sleep overnight, panting and pacing behaviours. These dogs can sometimes be referred into the neurologist because owners are convinced they've got something going on in their brain because suddenly they just won't settle and sleep overnight and they're very disorientated and upset. And that seems to be more kind of gastroesophageal reflux than kind of primary neurological. So yes, it can. In terms of Weetabix, I think all of those things. We have very little evidence base for things like that, and Weetabix is essentially wheat, and I don't really see how that's necessarily going to improve the situation. It's maybe better off using something like psyllium husk or something like that, which is again pretty benign. It's a soluble fiber; it will support the gut. But if there is recurrent diarrhea, even if it's relatively low grade, then maybe more from a diet point of view could be done to kind of try and optimize gastrointestinal tract health.
James Hunt was talking to me about psyllium the other day because there's a paper out about psyllium.
Hmm. Hmm.
Do you want to
Cillian is,
save me reading the paper? What was that?
so there's a few papers on it. My favorite paper is on working German Shepherds. So these are police dogs that go into, very high stress environments. And because they're German Shepherds and they don't have very robust guts, German Shepherds, they often get situational stress associated diarrhea associated with a very high stress environment. And so they started giving these dogs psyllium husk prior to these exposures, just all the time. And they found a significant decrease in the incidence of stress associated colitis. So I love this paper because there are some dogs that every time something stressful happens, they get an upset tummy and they get this situational diarrhea. And therefore, this shows the power of fiber. It's very, very powerful in certain situations. There are some dogs that don't tolerate it, doesn't work for them. Exactly the same with people. But certainly with kind of large intestinal diarrhea, which this kind of stress associated diarrhea normally is, it's normally inflammation of the colon rather than kind of further down, further up. It can be very, very powerful. So yeah, there's lots of good papers on psyllium, but I think it's cheap and it's undervalued.
Oh, gonna go and look into that. Okay, so this is a good one because it's very OA related. How does a consistent use of non-steroidals affect the microbiome?
So the way non-steroidal anti-inflammatories work is they inhibit the production of something called prostaglandins, and you have good and bad prostaglandins. So your bad prostaglandins are the ones that are involved in the osteoarthritis, pain, and inflammation, and those are the ones that we want rid of. And then you have your good prostaglandins, which do things like help your mucus production in your gut and protect your kidneys. And are there any studies looking directly at the effect of non-steroidals on the microbiome in dogs? No, very, very certain that this kind of information will come. But what we do know is that some dogs do not tolerate non-steroidals, probably due to this lack of prostaglandin production. Now, what that is doing to the microbiome and how that is exactly looking, is it inducing dysbiosis? Is the microbiome affected because the kind of intestinal barrier is compromised? And when the intestinal barrier is compromised, what happens is that all of the stuff within the lumen of the gut, so within the center of the gut, shouldn't really directly ever interact with the wall of the gut. There should be a good juicy barrier of mucus and stuff to protect that. So when we get that barrier being broken down, sometimes we can then get direct interaction with the stuff that's in the lumen with the kind of the wall of the gut. And that's when you can see kind of damage to that intestinal barrier, and that you can see a secondary shift no matter what the underlying cause is in the microbiome then. But mechanistically, what's happening within the microbiome secondary to non-steroidals, we don't know. I suspect it's
Very,
not good for the microbiome, but we just don't know.
no. However, I do remember to tell you this story. Sorry, it's not funny. It is. I've been at work all day. So I invited a specialist to come and talk to us about gut health. This was years ago. And I thought he was going to do a really balanced argument. And he basically came on and just went no to non-steroidals to this audience of people whose dogs were really
Oh,
settled, calm, balanced,
yeah,
doing well. The pain was
yeah,
controlled. They had their quality of
yeah,
life back. And then this
yeah.
specialist came and went, non-steroidals are
So
terrible.
are
I was like,
evil. Yeah.
no.
No,
So
no.
please, can you give us your view on how you would
Non-steroidals.
have hold that conversation?
So the vast majority of my patients have GI disease, and therefore non-steroidals, are not the drugs that I reach for, but they are undoubtedly the best drugs for osteoarthritis. They actually do something to help the primary disease process, which every other drug we pretty much have is just an analgesic, so it's just a painkiller rather than actually modulating it. And I think there is also non-steroidals and non-steroidals. So just because a dog doesn't tolerate one non-steroidal, i.e., something like Metacam, does not mean that it wouldn't tolerate another non-steroidal. And we see a lot of these kind of particularly elderly patients that have a bit of kidney disease and they have gut disease and they've got osteoarthritis and they've got some spinal disease. And for me, it's really about trying to find a compromise and a balance that maintains that individual's quality of life. And if you have
Mm.
chronic joint pain, your quality of life is going to be incredibly poor. And the best drug to try and manage that is undoubtedly non-steroidal or anti-inflammatory. So it needs to be done within the realms of safety, because if you are a dog who has a delicate gut, then you can be made to be quite a sick dog with a non-steroidal. So it has to be done safely. And one thing I would say is that non-steroidals are used up and down the country every day. They're probably the most prescribed class of drug on in the market. And yes, we do see complications, but given the number of dogs that have them, we see them very, very rarely. And most dogs, if they develop side effects, they tend to be diarrhea. If you stop it, it goes away. Yes, we see more serious side effects and more serious consequences, but they are rare. I see them, but I see the ones that have gone very badly wrong, which is a very, very small population of the whole population. So whenever you ask an internal medicine specialist how they feel about non-steroidals, they will give you a very biased answer because they only see the cases that have gone very, very badly. They do not see the ones that live on their non-steroidals in general practice day in, day out, because why would we see that population?
Yeah.
So I very rarely prescribe them because the demographic that I see, they can be inappropriate for. But do I think they're evil? No, I don't. I think they're an amazing class of drug and they definitely, definitely have their place. And if they're used properly, they are very, very safe as well.
And I think it'd be interesting, and it's a long way off, if we look at the amount of physiological stress pain causes, what impact that will have on the microbiome. So you could have two cohorts, those that receive non-steroidals and are therefore under less physiological stress because they're pain controlled, and
Mm,
those that aren't. And I think we have to remember that in life, everything is about looking at benefits and risks.
yeah,
So
totally right.
I do find it really difficult that people want to have a black and white answer
Yeah,
about things like this. And it's about working with your vet and talking openly
yeah,
and expressing your concerns and knowing that they
yeah.
are contactable if you've got any kind of observations that things aren't going according to plan. Do need to tag on to that because I know someone's going to bring it up. There was the study with the video capsules of dogs that had non-steroids. Do you remember that?
Yeah.
Are you happy to just
That, the
explain that
micro
study?
the micro bleeds one.
Yes. Yeah.
Yes. So there was a study looking at something called video capsule endoscopy. So this is where you fast a dog for a long period of time and then you give it a capsule which contains a little camera. And the little camera whizzes through the gastrointestinal tract, if all goes to plan, and takes a video on the way, and then it gets pooed out and retrieved by some poor person, and then gets sent off for analysis. And basically, you then have a period of time. It depends a little bit on the gastrointestinal transit time, but normally 8 to 12 hours of video footage of the inside, so the mucosal surface of the gastrointestinal tract. And there's been a couple of these done to understand the degree of kind of gastrointestinal tract bleeding, ulceration, complications, I suppose, are secondary to both steroids and non-steroidals. And the essentially the take-home message is that you can see some gastrointestinal tract, what we call erosions, which are kind of where the inside surface of the gut comes. It's not a full ulcer. It's kind of much more superficial than that. So you can see some erosion secondary to non-steroidals in some dogs. Okay. But there was no significant kind of ulceration. And most importantly, there were no clinical signs associated with these lesions. And so the clinical importance of them is uncertain. And the very similar data was found when the same study was done using steroids, so immunosuppressive doses of steroid, which you could argue are actually quite a lot harder on the gut than non-steroid or anti-inflammatories. So yes, can non-steroidals cause gastrointestinal tract bleeding? Yes, they definitely can. This is a well-recognized potential complication of non-steroidals. But even when it happens, it seems to be happen, and it certainly didn't happen in all dogs. That's one thing I should say. Even when it does happen, it doesn't seem to cause a clinically significant concern. None of the dogs became anemic. They had no clinical signs. There are always going to be exceptions to the rules. And have I seen severe gastrointestinal tract hemorrhage that I assume is due to non-steroidals? Yeah, I have. But in my whole career, I've maybe seen 2 cases. And that's not very many. That's really, very, really not very many. So yes, and of course, is it just the non-steroidal? Is it, did they go out and scavenge something as well? Have they got pre-existing gut disease and actually they've been given a non-steroidal on top of a gut that was just about coping? Thank you very much. there's always more complexities to a case than than is often kind of understood by the time it kind of gets
Yeah.
to referral.
And I think in that study, if I remember rightly, they hadn't been video scoped prior to non-steroidal use. So we didn't know whether there was any punctate um, bleeds prior. And another thing, and it's just talking about balance, is that at no point did they say, well, actually, yes, we might have seen punctate, but these dogs' quality of life on the canine brief pain inventory went from, 38 down to 7. So yes, they might have punctate ulcers, but actually, my God, that dog was living his best life with it. And that's one of the problems when we have these clinical trials. They really focus down on detail and they might not give us the overview, which is what the general public need.
Yeah.
I want to know what is the benefits and the risks for me to make the most appropriate decision for my dog. Okay, so
Mm.
moving on. What are your thoughts about fresh food diet when the owner is working closely with a vet on this?
Fresh food diet, as in home cooked.
Yeah, I think so.
Yeah. So I love a home cooked diet myself. If owners are dedicated enough to cook, then I bow down to them. And I do have some of my gastrointestinal tract cases that are on home cooked diet, but they need to be formulated by a veterinary nutritionist
Mm.
because we basically we have to give them additional supplements in order to make that diet complete and balanced. So there are some cases where their gut disease is so bad that they will not eat a commercial diet. You can play chicken with them until you're blue in the face. They'd starve themselves, and therefore home cooking is the only option. There are some cases where there is not a commercial diet which is available, which suits all of their needs. If they have complex and needs and they need actually a low fat, novel protein, but low protein diet because they've also got kidney disease, for example. Those diets aren't really commercially available. I recently diagnosed a dog, and he was also very, very overweight, and so he really desperately needed to lose weight for his joints. And again, that is not a diet which is commercially available. So there are some settings where home cooking is absolutely. Sometimes it's the only option. Sometimes it's the only option because that pet is very fussy. And sometimes, frankly, the owners really like to do it and are motivated to do it. And as long as it's done under the care of a veterinary nutritionist, I'm totally happy with that.
Amazing. Okay, so this is quite a long one, and I'm going to break it down into parts. I have a dog that has been on the watch list for almost 5 years, since he's been 6 months old. Symptoms being lack of energy, diarrhea, vomiting, and licking. Gut biome studies showed imbalance in bacteria. Various treatments, gut restore, other biome products, improved drastically. They went on to hydrolyzed diet, more improvement. After 12 months, reintroduced protein, which was managed through vet nutrition. However, still has episodes of low energy. So I assume that we're at a happy place. I assume that we're still on the hydrolyzed diet and they've been introducing. I get the impression from this that the diarrhea, etc., seems to be under control, but still having these episodes of low energy is now being tested and watched for atypical Addison's. Is there a tangible link between the gut and the pituitary gland? Blah, blah, blah. Start there.
Okay, so first thing that I would say is that yes, so atypical Addison. So Addison's disease is where the body does not produce enough stress hormone. So typically they lack two different hormones, cortisol and aldosterone, but sometimes they can just lack cortisol, and that is called atypical Addison's. And atypical Addison's can present as chronic gastrointestinal tract disease, waxing, waning, vomiting and diarrhea, sometimes low proteins, poor weight gain, just a bit non-specifically not quite right. So any chronic GI dog that I see, pretty much, I will rule out Addison's disease because it's one of those differentials that you don't really want to miss. So the cortisol is very important so cortisol is the hormone that atypical Addisonian dogs lack. And cortisol is basically, it's a steroid hormone and it's important for basically every functioning cell in the body. You can't maintain proper vascular tone, so proper blood pressure without cortisol. You can't maintain energy levels. You can't really maintain your immune system. You can't maintain kind of cell wall turnover, things like that. So it's vitally, vitally important. So if there is atypical Addison's, then it may well manifest as waxing and waning gastrointestinal tract signs. So yes.
Amazing. Um, I'm surprised you didn't pick up the gut biome studies because you had said that you felt that they were quite unreliable.
So
Do you
I
feel
was gonna, I didn't know
people?
how I didn't know how to say. So basically, yes. So I, this is definitely a soapbox for me, because I feel quite strongly that they should not be commercially available because we do not have enough evidence to interpret the data.
Mm,
I also find it very frustrating that recommendations and products are sold based on this information, which is not really evidence based. And I have actually had this conversation with two different companies that market these products. Um, I've seen some of these reports, including recommending regular feeding of blueberries and stuff like that. And I'm sorry, but show me some literature that actually supports, as a specialist veterinary surgeon, I try and be evidence-based. And if I make a recommendation, then it's either based on science or evidence. And sometimes it's very hard to get good, robust evidence in veterinary literature because it's hard to do studies, it's hard to repeat things, it's ethically challenging sometimes to put patients through procedures. A lot of our studies are retrospective, which means that we go back and gather data on cases that have already been in, which sometimes lowers the quality of the studies. But I do not think that we should be marketing and selling a commercial product that really we have no evidence for. So if a client comes to me and say, look, I've done this dysbiosis thing, I will say, well, that's very interesting, but I am not going to read it because I do not think it's going to help me manage your dog. And similarly, I do not recommend, for example, performing the dysbiosis index on each individual case because this is also commercially available because we do not know enough information about how we take that dysbiosis index from X to Y. You can also have a dysbiosis index which is apparently normal and a dog with hideous vomiting and diarrhea, or you can have a dog that's normal with a terrible dysbiosis index. The microbiome is too complex to make it that straightforward. And my normal microbiome versus yours, versus someone that lives in China, versus a dog that lives in, I don't know, in Africa, versus the dog that lives here, it's all different. So I think it's wrong to say that this is a healthy microbiome for a dog. We should try and make every single dog fit into this box. It's definitely more complicated than that. And we do not have the available data, in my opinion, to commercially be doing this.
do you know, I just love somebody stealing the role of ranting. It makes me feel so much better when I watch somebody else go because there are so many bastards out there that are quite happy to make money, aren't they? And I think it's really unfair on the public that they're so readily available. The other one would be food allergy testing as well. And you've probably got
Yes.
things to say about that too.
There's no evidence. If your vet says I want to do food allergy testing, tell them not to waste your money. There is zero evidence. So, food allergy testing looks for the presence of antibodies in the blood against certain dietary proteins. So, most dogs, if you do food allergy testing, you won't be able to feed them anything because it will come back positive to everything because every single diet, every single protein your dog has, you're going to expose its immune system to it because that is what happens in the gut. And therefore, unsurprisingly, some antibodies were made against it. Doesn't necessarily mean that they're allergic to it. So, immune testing for pollens, skin stuff, there is definitely evidence base for that. But when it comes to the gut, it is a total waste of money.
Thank you. Right, there we go. We've just saved people hundreds of pounds.
Yes.
Okay, Dr. Samantha Norris, you're here. I saw you arrive. Due
Mhm.
to the potential link between the microbiome and the development of OA based on the inflammatory nature, i.e., certain pro-inflammatory microbes in the microbiome can be present, would you consider preemptively placing certain dogs that are prone to certain GI inflammatory conditions, Shih Tzus predisposed to IBD, on omega-3 fatty acids since anti-inflammatory before we are able to confirm later OA later on in life and potentially preemptively slow down progression? Biggie.
Well done, Hannah. So good questions. And, again, I'm going to say to you, who knows, because we don't really have any evidence base. One thing I would say is that omega-3 fatty acids are usually never harmful, but because they're fat, many of these gut dogs do not cope so well because basically the higher the fat the diet, the slower the gastric emptying, and therefore the more likely you are to get gastroesophageal reflux disease. So certainly you can, and if we look at, say, for example, the dose of omega-3 that we need to give. So, for example, there are some diseases where there's really good evidence base, like kidney disease. There's certain types of kidney disease where there's really good evidence base to give omega-3 fatty acids. We actually normally end up giving like 3 or 4 times what is kind of normally recommended if you just buy a commercial omega-3 product from online or wherever for veterinary patients. And so, we would generally speaking have to start them very slowly and increase the dose and see how they coped. I feel like this is one of those things that it's unlikely to do harm as long as they tolerate it from a gastrointestinal tract point of view. The thing I struggle with, and it goes back to that kind of ethics thing, is as a clinician, should we be making a recommendation that involves owners parting with money when we don't know whether or not it's got a therapeutic benefit? And if owners ask me, can I give X, Y, and Z? And I say, I don't know if it helps, but it's not going to do any harm. And I very much put the ball in their court, because I feel, if there's something that I know is going to help, I've got evidence base of lots and lots of clinical experience, and I think that's one situation. But if you're giving a decent dose of omega-3, it comes quite expensive, and these products are sometimes not cheap. And so I think it's tricky. It's like, saying, oh, take these probiotics after this course of antibiotics, when actually you have no idea whether or not it's going to do anything helpful. So I think, as long as they can cope with from a gut point of view, I don't think it's the wrong thing to do, but I think it's hard to advocate it for it when we don't know whether or not there's no science to know whether or not it does slow the progression of disease, for example. Do you
Can you
agree, Hannah?
just, yeah, well, I just loved what you just said right at the beginning about a lot of the omega-3 products that are on the market are highly underdosing
Yeah.
compared to the clinical evidence. And I find that really challenging when you look at the
Yeah.
packet and you look at the size of the dog and you go, you want to give 600 mgs to that 20-kilo
Yeah.
dog?
Yeah.
No, that's not what the
Yeah.
data says.
And some of the products you end up giving like 6 capsules or something twice a day. And it's just,
Mm.
it's just, there are some products which are a bit better now, but some of them, if you have a big dog, it's obscene, how much you have to
Mm.
give.
No, and it's just I just find it quite complicated where you've got a company that is pushing out this product and it's all in their literature and it's on the packet and it's clearly states for this size dog you should feed that. And you as the clinician go, well, the papers I've read suggest very otherwise. And it's not that the product is wrong, but as you say, you're suddenly suggesting to the caregiver you've got to do 3 times what they recommend. And then there's that conflict, and you're like,
Yeah.
as you say, it's really pricey. Okay,
Yeah.
next question. My dog's gut is normally fine, but she was recently put on Flexidin. Miserable, much lamer, stopped after 6 days. Happier, but has taken another 3 weeks for her to recover. She's still more lame. Will she get any better? And is there anything else I can give her? She has elbow dysplasia and a large arthritic lump on her front leg. She's on Roxbexera in the morning and amantadine in the afternoon. Her normal diet is raw um, canine prime powder plus protein. She's a retired guide dog. So going back to the beginning, it sounds like Flexidin may have upset her gut. My dog was finally fine, but she was recently put on Flexidin. Miserable, much lamer. Stopped after 6 days. That's interesting because that's undenatured type 2 collagen. I've not heard of dogs doing badly being put on it. I've just heard it not potentially doing as
Doing
much as you'd
much.
like. So I don't know if,
Cast on my limbs to get better. So I suppose it's tricky, isn't it? Without knowing which leg she is lame on. I
or
don't know
did the
what
Flexidin upset the gut? Is there a link? Did the Flexidin upset her system?
The Flexidin upset her system, definitely. She was miserable. Its side effects said she could be sick. It could make her sick. She wasn't sick. She was just miserable, much lamer. She's only just recovering and getting her sense of humour back and feeling better.
Mm.
It had a dramatic effect. Stopping it, she was considerably better within 3 hours, 4 hours.
Okay. It's not something that we often hear about having reactions to supplements, but then there are many components in a supplement. So whether she's got a unique intolerance, Um, and then did you say it caused a gut upset or she just wasn't herself? She was just
She still ate, but she was unwilling to eat, and she's a Lab retriever. She always eats. I had to call
okay.
her twice for her dinner. She'd sleep through her dinner.
Oh, wow. And did you
Mm.
get any vet support with any kind of like I'd be tempted to go down to things like the ranitidines, the omeprazoles, anything that could potentially get rid of any nausea or gut upset, or am I wrong, Catherine? If I've
No,
got a dog,
I just took her off them, and she's recovered slowly, but it has been slowly.
okay. Would you be, that's a question, could put myself in a vulnerable position. If I had a dog that was showing post changing of the diet, nausea, inappetence, would I be wrong to be using any of those support medications?
So I would go down the antiemetics. I wouldn't go down the gastroprotectant route. So anything that suppresses acid production, omeprazole, famotidine, ranitidine, etc., will have a negative effect on the microbiome because, of course, as soon as you change the pH of the pH of the stomach sets the tone for the rest of the gastrointestinal tract. So omeprazole I will use if I've got overt gastrointestinal tract bleeding, so
Mhm.
dog with black poo or vomiting blood, or I've got very severe esophagitis. Those are for me are the only indications to give it, and we now give it much, much, much less frequently than we used to. Um, there's also a school of thought, and this is very interesting. So, historically, if we were giving a non-steroidal anti-inflammatory, or say, for example, steroid, and we were a bit worried about the gut, we would just pop the dog onto omeprazole and feel better about ourselves that we've protected the
Mm.
gut. And there's now a few papers in human medicine that shows that actually, paradoxically, sometimes that can increase the risk of gastrointestinal ulceration. And the assumption is that it actually has a negative impact on the microbiome. So therefore, you degrade the gastrointestinal tract barrier further. So I will never do that. I never now use it as a band-aid. If the dog is going to get non-steroidal induced ulceration, it's going to get it whether or not you give it omeprazole or not. So I think using it as well, I'm going to give steroid and I'm a bit worried, so I'll give some omeprazole. Is some of my colleagues will still do it, but I don't think it gives us security that we once thought. And in my hands, I think omeprazole causes diarrhea and nausea fairly frequently, and so I tend to avoid it unless I really think the patient genuinely needs it. So I think an antiemetic totally appropriate and reasonable thing to do.
Amazing. And then ranitidine's gone out. So we'll come back to CEG, don't know your name, but ranitidine, because that went through a massive fad as well, probably about 10 years ago.
Yeah,
Everything was going home on ranitidine, wasn't it?
yeah. Yeah, ranitidine and sucralfate, so antepsin. I mean, honestly, I mean, when I was a student in IC, literally every single patient in ICU was on sucralfate and ranitidine. Every single, they would walk in the door and they'd get ranitidine IV. It was just given to everything.
Everything.
Um, yeah, and it's just completely gone in a full circle now, and we realise that it's just not necessary.
Not necessary, fine. So the reason that we jumped here, CEG, was because I was just saying, if I was your first opinion vet and I'd prescribed you the Flexidin and you came back to me a few days later and said, look, she's really miserable, I'd have this wave of responsibility of, oh crap, okay, well, yes, we'll take the Flexidin off. It's going to be a matter of time for the body to normalize because we've got amazing ability. Our bodies are so resilient to heal themselves if we give them time, which human nature doesn't allow anymore. We are a society, we want everything fixed quickly. And if we can't do that, what can we give them to fix them quickly? But I would be socially obliged to try and give you something because you've come in, you're paying me, so you're going to want to go away with something. The dreaded hand, the tangible item. So I would have been inclined to think, do I need to give something to try and support that dog obviously feeling nauseous and uncomfortable? And that's where Catherine's just taught me, which is great, to not use things that are actually working on the gut, but to work on the chemoreceptor trigger zone. So we're using our anti-emetics. So thanks, Catherine. I feel great. I feel I've had CPD today.
Welcome.
But with regards to her recovery, is there anything that you would be thinking of gut support? Because we've talked about prebiotics, probiotics, not likely. Psyllium, maybe.
Yeah, I mean, none of these things are wrong. And I think though that I think time is the thing that's going to work here. I think she'll just gradually fix herself. And I think that sometimes the more we mess, the worse it gets. Um, um, and we historically 100% of the time we would say dogs got gastrointestinal tract, say for example acute diarrhea. How many people still give chicken and rice to that dog when it's got good vomiting or diarrhea? This is what we all used to say. Starve the gut. This was something that we used to say. So 2 or 3 days of not eating at all if there's any diarrhea. We now don't say that at all, because if you starve the gut, the cells that live in the gut only get their nutrition from the lumen. So if there is no food in the lumen of the gut, those cells have no nutrition and therefore no ability to repair themselves. So we don't starve the gut really ever. One thing I do say to some clients, though, is that if your dog has copious diarrhea, the more you feed it, the more diarrhea will come out. So there is probably a sweet spot between feeding him normally and not feeding at all. So you could, for example, feed half portions or something just to try, especially if there's large intestinal diarrhea and they're going a lot, they're going multiple times a day and they're quite uncomfortable with it. It's actually not dangerous, but it's just not very pleasant for anybody involved. So it's not wrong just to feed them ever so slightly less. But I personally would not be changing the diet in the first instance with acute gastrointestinal tract signs. I would just keep feeding what you are feeding. Again, there is zero evidence to feed chicken and rice, and it makes no logical sense. So just keep feeding what you normally feed. And if the clinical signs don't resolve after 3, 4 days, then this is where we might start thinking about, okay, maybe we need to switch into kind of long-term kind of diet management situation. So we don't really think about chronic diarrhea until the diarrhea has been there for 2 weeks or more. That tends to be the cutoff point. And one thing I would say is that, of course, there is diarrhea in a dog that is running normally, eating normally, happy, waggy, and then there is diarrhea with a dog that's vomiting, feels miserable, doesn't want to get out of bed. Of course, in that latter situation, you would always go to your vets and get some advice as well, because maybe they do need some antiemetic support and stuff like that. But otherwise, yeah, just keep feeding what you're feeding, just feed slightly less.
And that also, I'm about to drop a massive bomb on the vet industry. The way that we for years have given them a new diet to go home after a minor procedure.
After
So they,
not, I know.
and you just sit there and you go, oh no, we shouldn't have done that.
The little packs of recovery diet that we think we're doing the
Take it
right thing, and
home.
actually, but the nice thing about being a vet is that we learn all the time. The advice changes. We constantly strive to do better. And
Yeah.
so what we recommended 10 years ago, we don't recommend now. And that's just because we know more and we've learned more. And that's actually quite a cool position to be in.
Yeah, and I like that. I like that a lot, especially when you're old, 23 years or
Yeah.
something awful. Um, Something that I did pull out though as well is the fact that if she wasn't feeling right after the Flexidin, still being on the Rebexera, which I imagine is Robenacoxib. Um, for me as a first opinion vet, I would be saying, well, that could be stimulating some gut upset, as could the amantadine. So amantadine has got a link to causing vomiting, hasn't it?
Yeah.
So there's a real tendency for us as humans to fixate, well, that must be the problem, but there could be a coincidence. The Flexidin might have triggered an upset, and actually the other medications are having some involvement as well. Did you stop them or did you stay on all of them?
No, I stayed on. I stayed on everything. I dare not stop them because of the pain levels she has.
Right.
A gabapentin made her stoned. She was absolutely dreadful on that.
Yeah.
And they put her on the Robexera and the amantadine as a trial, and she's been on it for over a year.
Yeah.
So
So
we're managing with that. And at the moment, unless we go on to the next level, I believe there's one more level we can go on to.
yeah,
We stay put.
absolutely. I do always bear in mind that you can stop and go back on them. So say that the Flexidin upsets the gut to a degree that then additionally having the Robenacoxib on board aggravating it as well. So it might be that actually you come off to go back on just because the
Right,
gut's got to
right.
sort itself out. So these are all speculations, we don't know.
Yeah.
But when stopping the Flexidin, if we'd stopped the Robenacoxib at the same time, you might have found she recovered quicker. We don't
Yeah.
know, but there's a
Well,
possibility.
the sickness side of it, or the misery has gone. She's just seems to be lamer. But with very hot weather and everything else, it was very difficult to see what was really affecting her
Yeah, yeah.
because she does not appreciate hot weather.
No, it is difficult. There are alternatives as well to pharmaceuticals. So you might want to look at massage, laser, acupuncture, all of those sort of things too.
She has massage, she has laser.
Amazing.
Her physio came when she was on the tablets and was horrified how badly she'd gone down. She's due in the next 2 weeks, and I'm hoping she will see a different dog this time.
Good, 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 good. From my perspective as well, if you've got a dog that is very acutely lame in an area and it doesn't seem to be improving, so say it was an elbow or say it was, then do accept that things can change within the joint. So if I had a
Yes.
dog that was acutely lame in a stifle and it hit a knee and it just was not teetering out of it, I'd be like, what else is going on there? And it might be that you have to pop back to the vets, and it might be that they have to do an x-ray, or they might have to stick a joint needle in and just tap the fluid and make sure something nasty isn't starting.
Ah, right.
Yeah,
And so that would be a good idea to go back and get him just to have a look at this joint.
yeah, I would do. So if you've got something that really is not responding, so acute flares tend to be like anywhere between 5 days and 14 days. And I think if you've got a focus of inflammation that is not resolving and you're not coming out of that flare, then it's a case of reinvestigate.
She's now hopping every now and again.
Okay, I would speak to your veterinarian and just
Right.
get their eyes on it and not be scared if you can hopefully afford it, that if this is a persistent thing, get another
Yes.
x-ray and then tap that fluid and just check that you haven't got something else going on.
Great. Thank you very much.
So can you add anything, Catherine?
The only thing that I was going to say is that robenacoxib is a non-steroidal anti-inflammatory, and it may well be that she's coped with that very, very well for a long period of time, but something has upset her gut, whatever that is, and therefore that non-steroidal may just be perpetually aggravating her gut while the gut is trying to recover. And this is a situation where sometimes we do have to pull the non-steroidal out, just even for a very short period of time to allow the gut to recover. But other things can be given in that period of time to make her analgesed, and then we add it back in again. Because if we carry on giving the non-steroidal anti-inflammatory to a gut that's under pressure, then this is when we can see more serious complications. So I think if you have a patient with, vomiting, diarrhea, anorexia, we really shouldn't be giving non-steroidals to that population, because that's when we can potentially see very serious consequences. Although I have to say robenacoxib is usually more forgiving than some of the other non-steroidals, but I would be worried about that.
She's eating normally now, and much better. She looks fit. She looks beautiful, but she's just that bit lamer than she was before it all happened.
Okay, fine, perfect.
Lovely. Okay, just looking at time. So I'm going to do 3 more questions. Any thoughts or experience on interaction, influence of gut health and paroxysmal dyskinesia, and any suggestions for dietary inclusion, exclusion in that context? Do you know, I was talking about that. Can you explain to them about paroxysmal dyskinesia? I said that today. I actually said that to somebody today. How weird.
So proximal dyskinesias are essentially a group of movement disorders. And a movement disorder is normally something that comes to see the neurologist. So a classic dyskinesia dog can look. So sometimes they'll come in and say, the owners will say, I think there's been a seizure, or they fainted or something like that. Sometimes they will come in. The most amazing one I saw was a dog that would be walking and suddenly go stiff, like it had been stunned by some kind of stupefied curse on Harry Potter. And then he would stand there stunned, stupefied, and then he would sometimes fall over. And it was very dramatic. And these are the kind of things that you can see with dyskinesias. And like I say, normally come in through neurology, and sometimes they can be really dramatic and very scary for the owners, but they are not harmful. They are not seizures. They do not progress. But we definitely see a link between dyskinesia and gut health. So most dyskinesia dogs, if you press the owners, they'll say, oh yeah, there has been some diarrhea recently, actually, or actually it's been off his food and had some vomiting for the last 24 hours. Now, what exactly is going on? Dyskinesias, we don't understand what causes them. They're called, the medical term for we don't know is idiopathic. So if your vet ever says idiopathic, insert a term, this means that we don't understand the etiology or the cause of a disease. So, yes, I would. So essentially what's going on, we don't know, but an exclusion diet is almost certainly the cornerstone. In most of these dogs get better on an exclusion diet. So is it some kind of, and again, it tends to be, we tend to do a gluten-free exclusion diet just because there are some definitely movement disorders, particularly in Border Terriers, where we can see something called Border Terrier cramping syndrome, which definitely seems to be linked with gluten. We have much less evidence for gluten-associated stuff with other dyskinesias, but certainly I feel like doing a gluten-free diet trial is a very sensible thing to do, and the vast majority of them do get better with exclusion diet. So yes, they are benign, and normally sometimes they persist but are very low grade, and sometimes they resolve altogether.
Sorry, the Moroccan street dog has decided it's home time. So it's got this barking in the background. So Laura, we've talked about using proton pump inhibitors, and the fact that it can increase. I can remember Kenneth Gibault was talking about it a few years back about how they saw the location of the ulceration changing in the gut. So by using the PPI, it was actually making them more descending, um, so lower down towards the ilium, which were much harder to manage or something along those lines. I can remember him mentioning.
Yeah.
Right, because that's the normal thought for the caregiver, because we do it in humans, isn't it? Lots of people are put, was it latanoprost or something
So, I
alongside?
mean, you can buy lansoprazole, it's over the
That's it.
counter. You can, yeah, anyone can get it. You don't even
Yeah.
have, yeah, you can just go and buy it.
Yeah, because my dad's on quite a few meds, and that is part of his
His protocol.
protective. Yeah.
Yeah, yeah.
Um, Okay. I'm a trainer working with a cavalier who reacts to noises, wakes in the night, resources guards. He has a reduced appetite, is underweight, with regular loose stools, gurgling stomach, lip licking, and swallowing. He's seen a vet who diagnosed a bug. I've put him on a gut diary with poo pictures. I'm not sure if there is such a thing, but I developed one because I wanted the data to show the vet. Is there anything else I can do in terms of bridging the gap between client and vet? I love her.
Yeah.
That's
I mean, what you
amazing.
have described there is a dog with a chronic enteropathy. Um, so, so essentially, my approach to any dog with chronic gastrointestinal tract signs is the first thing you need to do is you need to make sure that there are, or the vet needs to do, make sure there is no what we call extra gastrointestinal causes. So liver disease, kidney disease, Addison's disease, we've already discussed. So it's really important. If blood work has not been done, I think that should be done just to tick that box. But, exclusion diet, this is, did you say young dog?
Didn't I don't think
Skinny?
mentioned. Cavalier who racks the noises, wakes in the night, resources guards.
Don't know age. Okay. So when you have an underweight, when your dog is underweight or not gaining weight, then
It's
this is
two,
actually very
two,
two. Okay, perfect. So this is actually quite a helpful clinical sign because there's only so many things that cause weight loss. Either you're not eating enough calories, you're not able to access those calories, so you've got malabsorption or maldigestion. You've got some kind of protein loss via some kind of system in your body somewhere, or you've got some kind of weird and wonderful disease that's just driving your metabolism faster. And as much as we all associate kind of things like cancer with weight loss, you are literally, cancer, you have to be very, very end stage really to see weight loss. And same with things like heart disease and stuff like that. So yes, we can see pathology driving weight loss, but actually that is pretty clinically rare. So if you have a dog that's underweight and has chronic GI signs, then this is very likely because they are eating, but they're not able to access the nutrients in their diet. And therefore they either have a combination of malabsorption and or maldigestion. So this is a dog which will definitely, this is exactly the demographic that I'm talking about. We have a dog that has behavioral concerns and a very sad gut. And this is where the gut and the brain are totally sad and out of sync. And if we were to do an exclusion diet in this dog, I guarantee you that we would see an improvement, particularly as a young dog. So statistically, patients less than 6 years old have it depends on the paper that you read, between 65 and 85% chance of responding completely to an exclusion diet. So it is really, this population is the population where diet can be literally a miracle cure.
I read an article in a magazine from, I think they were an internal medicine specialist, saying, I think I'm going to be made redundant. And that's when the exclusion diets came out,
Yeah,
because they were so effective and people
yeah,
were bypassing doing these extensive workups and these extensive
yeah,
diet trials and these extensive
yeah,
medication courses. And he was like, I think we found the amber nectar.
yeah, yeah. So for example, I don't do endoscopy. So endoscopy and take biopsies. I don't do that now before a diet trial. I just don't do it because I don't
Yeah.
need that information. I will always do an abdominal ultrasound normally because I just want to make sure I'm not missing anything. And every now and again, you'll be surprised. You'll find a sock foreign body that's been floating around in the gut, for a while. That's happened to me once. And I was like, this dog is never going to have a foreign body. This is clinical signs have been going on for 3 months. Had to go and grovel to the surgeons. So there's always the exception to the rule. But yeah, diet is totally going to help this dog. So that is
Amazing.
something which is a very benign thing to do. You're not treading on the vet's toes there, in my opinion. I would definitely go down the hydrolyzed diet route.
Okay. I think that is a complex one. I love the fact that all the people that come and talk on cam are really open and kind, and they don't feel threatened, and they're humble and accessible. In my experience, you could offend a vet. So I think, let's be honest, we don't know. And as the canine professional, and something that Cam's working really, really hard to try and encourage, is this multidisciplinary team approach.
Mhm.
But we prefer the word interdisciplinary because it means that there's better communication between the different elements of that care team. So, as the canine professional, it would be lovely for you to either speak to the vet or see if you can get involved in maybe one of the consultations of the caregiver with that vet. That's not uncommon, where a client will say, can I bring my dog trainer, because they're really involved in this, in his care. But just be a little bit careful. I know I'd be okay with it. Catherine would be okay. Samantha would be okay with it. Some people might feel threatened, mightn't they?
She's right. She's true. She's right. If a behaviorist recommended an exclusion diet, I would jump up and down and cheer.
Yeah.
But that's just me.
Yeah, no, it's funny, and I think we're all in a very prickly world at the moment. It doesn't take
Yeah,
much to piss someone off, does it? So
yeah,
that's just
yeah.
what role does B12 play in gut health? And I think I'm going to possibly call that the last one. Maybe we can save some of the questions till next time, because Catherine, you're popular.
I could definitely come back. So, I mean, I love B12. I think it's a very important B vitamin. So B12, so B12 is important for the gut for two reasons. So we measure B12 because B12 is absorbed very specifically in the last bit of the small intestine. And so it tells you whether or not you've got malabsorption in the gut. So if you have a really low B12, then your gut or your pancreas, sometimes you can lack something called intrinsic factor from your pancreas, is not working and is under the cosh. So it's diagnostically useful, but B12 is an essential cofactor in DNA synthesis. And when do you make DNA? When you make new cells. And what part of your body do you make new cells in every single day? Your gut. So you cannot repair your gut if you do not have enough cobalamin, so B12. So this is why we always, measure it and supplement it if it's low, because it is, there are some potential very serious complications associated with low B12. We don't tend to see anemia. So in people, we can get something called pernicious anemia. We can see that in dogs, but it's quite rare. We actually see more neurological consequences more than anemia consequences. So it is very important. So this is how it works. Basically, it enables the enterocytes, so the cells of the guts, to replicate, and therefore that gut wall to repair itself and gut integrity to be reestablished.
I love it. I love it. Right, guys, keep your questions. We will get Catherine back. She's just So glad that we did tonight. I'm sorry that we had to postpone. It's busy people at work, isn't it? What we will do is we'll ask Catherine to come back. It will be probably next year because believe it or not, we're fully booked all the way through, I think, till March. Evie's been busy. Um, but thank you, Catherine, for sharing your knowledge with us and your passion. I love it. You're just like so enthused. It's great. It's great. And I've definitely learned stuff tonight. So I hope that the rest of the people that have been listening have learned too. So please do say thank you. We will, a little bit of truth, guys. We're cutting down just to once a month. So we were doing a members own live special once a month and a tea and chat once a month. I just can't sustain it. I'm struggling a little bit with work and trying to keep to all these commitments. So what we're having now is a members owned live and a tea and chat in alternate months. Please don't be disappointed. It's just I can't sustain it. If people want to volunteer, Samantha, to come and host, you're more than welcome to step in and fill my boots. I'd love that. But yeah, it's just been a little bit difficult recently. If anybody would like to hear from Catherine, she has got a lecture in the Chronic Pain Symposium 2025, which are available in our Learning Academy. It is fantastic. The Chronic Pain Symposium, I think there was about 30 to 40 lectures. You will be lost in chronic pain for a long time. Learny, learny, learny. So please do go and access that as well. All funds go towards CAM and keeping us going because we are independent to keep these services non-biased towards you. Thank you so much for your time, guys. I'm going to leave and start again tomorrow. Where does the time go? Are you the same, Catherine? Does it just kind of like piggyback?
Yeah, absolutely. Yeah. I mean, I've eaten today though, so today's been a winner.
Well, actually, I've got a load of dirty cookies, but because you were talking about
Oh,
the
there
gut, I
you
was
are
like,
then.
can't eat them now. Cool. Right. Well, take care, guys. It's lovely to see you. Thank you for showing up, and we will see you next month. Bye.
Thank you, everybody. Thank you for amazing questions.